also like to address to both Mr. Gross and Mr. Keeble.
Can't hear.
And
We can't hear.
Bit closer.
Closer.
Mr. Gross, you mentioned in your opening remarks that attracting healthcare professionals to Kerrville was your #1 priority. So I'd like to ask both of you, specifically, what can the city do to attract healthcare professionals to Kerrville?
Thanks, Betty, for the question. I think it's a very important question. It's one that Dr. Michael Grocke attended a council meeting fairly recently, maybe a couple of months ago, and talked to the council about. He is a Comanche Trace resident. He's a local physician. He has, I think, 1,400 patients, and he talked about our critical shortage of doctors. And he stated that 20 have left our community during the past few years, and we've only replaced them with about 1 urologist. And it's obvious that if that current trend continues and our doctors continue to leave us for the hospital in Fredericksburg and for the new one under construction in Bernie, we're going to be in a crisis if we're not already in one with regard to providing enough doctors. I just talked to the McCoskos a few nights ago, and they told me that when they moved here, they had a very difficult time locating a doctor. They called all around, and it was very challenging for them. And so I think this is certainly an important issue. What can we do? Well, I know this much. When Dr. Grocke came and talked to us, I thought to myself, wow, this is a pretty important issue. This is something we really need to be moving on. What kinds of discussions are we currently having between, let's say, Pat Murray and the council, or Pat Murray and the staff, or members of Sid Pete Medical Board? What kind of things are we doing along those lines? And I've yet to hear much, frankly. I'm not on the council, but I've yet to hear much about what's really going on to address them. I think at the very least, it's time to initiate some discussions along those lines, and let's see what we can do to try to address this situation. How can we recruit doctors? What do they want to see? I had a long talk with Dr. Grocke about it long before he attended the council meeting, and he said that it's very difficult here because we just don't have the amenities that, and if this is sexist, I'm sorry, but the way you put it, that the doctors' wives want. They're used to being in a lot of towns, big cities, where they have access to a lot of amenities that they don't find here, and so it's very difficult for us to attract them here. And that is a particular challenge. Just what we do, I'm not sure what the answer is. I'm not sure that many folks know, but it's sure time to start talking about it, because if we can't provide our residents here with the proper medical care that they want and need, if they have to travel elsewhere, they're going to be less likely to want to move here and less likely to want to stay here. And I do know that there are some there are some actions being taken, some discussions being had, but I just haven't been privy to those.
Thank you, Robert. I just wrote a book a few months ago. In the book, I have to quote one doctor who said to a friend of mine, he said, "I'm just a high-paid assembly line worker." Doctors leave crappy systems and places where they're not made to feel welcome. One of the things that we have going on at Sid Peak is the Nurse Friendly program, which is sort of pioneered here in Texas. And it's a whole new mindset of how people are managed. But you got to understand, the connection between the city council and the hospital is just a speaking relationship. No legal relationship. We can have the bully pulpit, that might work a little bit. But what I propose is this. First of all, we can help them with building codes. I don't quite understand that, but Dr. Grocke mentioned it, and there's some changes that we can make, and we are exploring that. And also we're exploring the issue of medical facilities. Can't tell you any more than that, but it's something that's coming up on the horizon fairly soon. I think we could give them some economic incentives, some money to move their offices or move their families. And I think we need to roll out the red carpet. I think they need to meet the city council. They need to be wined and dined and loved on, and that will go a long way. Now, as for the amenities from the big city, I just got to tell you, those of you who are dying for an Olive Garden, come on. But people say they like to come up here because we're different, because we're a small town, because they like the independent shops and the independent restaurants. So we're not Houston, and we're not going to be Houston, and we need just to get over that. But I think that's what we can do. And one of the things that council can do and is doing is that when we took over KEDF, Her Economic Development Foundation, you know, we have one guy, literally one guy, Guy Overby, out there trying to A, raise funds to pay his own salary, and then B, trying to bring people to town. Well, this is your city council acting, I think, very responsibly. We have increased the funding, we've changed the organization, and I think we're going to see some real positive results. The only thing that I would apologize for is that we probably could have done this a little bit earlier. But you know, when you're looking at 40 of your fellow citizens, and they're the movers and shakers of the town, you sort of have, you kind of want to believe them. You want to think that they're on top of it. Well, they weren't on top of it, and we got it fixed, and I think we'll see some results real soon.